Yeah, thank you so much, Anna. I will not go back and introduce myself. So maybe you can move to the next slide, then we start. Yeah, so we are doing this also in loving memory of my closer friend Dr. Claudine, who is a friend I have ever had, and I don't know if I will get another one to replace her. So who was actually, I lost her during this period of the disease, and actually I got the disease from her. Maybe I will come back on her during my discussion. Yes. So now talking about this Marburg virus. So it is a viral hemorrhagic fever, which is closely related to Ebola and Lassa fever. And this was first identified in 1967 when the laboratory workers from Germany became ill after handling biological material from African green monkeys imported from Uganda. So the natural reservoir of this virus is the Egyptian fruit bat, which is by the scientific name is called Rusetus egyptiacus. And especially it is in an area like the Gamiko mine. So these bats usually do not show symptoms, but they can shed the virus through urine, droppings, or saliva. So humans and animals can become infected through direct contact with these secretions or with the bat themselves. So the virus is most commonly found in sub-Saharan Africa next. So usually what happens if you are in contact of this bat or with their secretions? So first of all, these viruses are going to infect the immune cells like monocytes and macrophages, and then they start to multiply inside the cells. So as the cells get bigger, they get burst, and there is a spread throughout the body, starting from the liver, lymph nodes, and the other organs. And then the next step usually is a massive release of inflammatory cytokines. And this is trigger a systematic inflammation, coagulopathy, but also endothelial damage. As the disease progresses, so there is kind of cytokine storm, which causes vascular permeability and contributing to shock, but also multi-organ failure, and if it's not stopped, there is the death. So as area symptoms, you can have fatigue, generalized body weakness, and actually in my, when we had this, I'm like, all of us, we face this symptom. So there's a sudden onset of high-grade fever. And again, almost all of us faced this when we are having this Marburg virus. So there's severe headache, which can be really severe and intense at the level of being debilitating. There's muscle itching, which was also in our cohort. This was at a higher percentage rate. There is malaise, and everyone who was having this virus in our cohort, almost like 99% were having this symptom. So there is sore throat, which is actually, which can be presented, and some of us had it. So as the disease progresses, you can have gastrointestinal issues, mainly vomiting, diarrhea, abdominal pain, and diarrhea is really bad at the level where someone who is able to move is obliged to put on Pampers because you don't know where things come. So we face this issue. So there's also chest pain in some patients. So some patients really had chest pain. Personally, I didn't have it, but some patients had it. So rash on the skin, almost all of us in our cohort had this issue. So there is red eye and itching. I remember one day, in the morning, we wake up, all of us, finding ourselves having this red eye and itching. So breathing mainly, it can happen in the middle phase because some of us female had unexpected periods, which was coming from this Marburg, but also this is almost like 100% in late phase because all of the people who died actually were having bleeding everywhere. So neurological symptoms also are possible. I remember because I was with one of my residents, a third-year resident, and I kept checking on him, even if I was sick as well. But one morning I wake up and I went to check on him, and I realized that he was confused because he couldn't localize himself, asking us, why did you change my room? And yet he was still in the same room. Multi-organ dysfunction, this is also something which happens. It can be like starting where you have like 2 organs which are affected, going up to many organs, as many as possible. And that's what the people who passed away faced. So shock is very possible because if you're having vomiting, diarrhea, which is combined with this cytokine storm, shock is really very possible. Next. Yeah, so our case in Rwanda, Marburg hemorrhagic fever, most outbreaks have occurred in Central Africa. So the first ever Marburg outbreak in Rwanda, the last one, happened in late 2024. So on 27 September 2024, that's when the first ever case of Marburg disease virus was confirmed, and this was from my friend. And so over the course of the outbreak, 66 confirmed cases were recorded, and 15 only died, which made the fatality rate of 23%. And this is very different from other neighbor countries or regional countries where the mortality rate has been counted from 80 to 90%. So also, the cases started rapidly during late September and October, concentrated in the first 3 epidemiological weeks, and the last confirmed case occurred on 30th October 2024, and outbreak was declared over on 20th December after completing 21 days incubation period. Next. So who was affected? So 70 to 8% infection occurred in healthcare providers, mostly ICU people, but also we are having non-physician anesthetists and other physicians. We're having among them some ENT surgeons, some emergency physicians. Next. All right, so now, how about the response and containment? So in our case in Rwanda, there was, I can say the response and the containment was very rapidly done. So there was a very rapid and coordinated action. And this was led mainly by the Ministry of Health, supported by the World Health Organization in Africa, CDC, and the other partners, which implemented robust measures, including, contact tracing was really well done, isolation of cases, and monitoring of nearly 300 to 400 contacts. What was done, among the things which were done, there was also experimental vaccine deployment, clinical response, so which include, despite the lack of licensed treatment or vaccines, Rwanda launched an experimental ring vaccination campaign, and around 700 doses of candidate vaccine were first delivered, following by additional doses of, to reach over 1,500 from the frontal line worker vaccinated. And the combined strategy includes the use of the severe and other investigation treatment. So all of us will receive this medication in our isolation area where we were hospitalized. Preparedness and the early detection, there was effort at symptoms monitoring and buffer zone between bat habit and human activity, and active surveillance at mining sites were established to reduce zoonotic risk. So there was also a strong baseline system payoff Rwanda existing emergency response framework and build up in part of COVID preparedness. You can understand that it's facilitated the early containment. Next, please.
I want to just comment here, if I may, Francoise, because I was actually in Rwanda when COVID-19 first broke out, and I remember overnight Rwanda had almost every building you walked into, you had your temperature checked, and all over the city of Kigali were hand washing stations, and the response was so incredible and so rapid. And certainly much better than the response in the United States. And I think this is a really great point in that the Ministry of Health in Rwanda learned from the COVID-19 experience and to prepare for additional outbreaks. So it's really a testament to strong public health measures in preventing further spread and further deaths. So it's very amazing.
Yeah, thank you for the compliment. Now, so what were we able to do? So you can imagine, so going down to in terms of fatality rate, up to 23%, comparing to our regional neighboring country, that was a great achievement, and that was from the coordination and being able to bolster the IPC measures, which were existing addition to what was add-on according to the requirement. Despite the disease severity and the high potential for fatality, Rwanda implemented a rapid and comprehensive response, leveraging and existing a strong health system, as I was saying, as Anna was saying. Then, so some of the tip was early detection and isolation. So here I remember that by the time we said that this is Marburg, from down there, the list was made by the DGs, sitting in the office, asking everyone who was in contact, and the isolation was done immediately. Actually, like everyone who was a suspect was really isolated. And there is this contact tracing. So they, from person X going down to the last contact, there was that kind of trace. Then there was this prioritization health worker safety, where we everyone who was suspected as a contact was removed from the rest of the workers, and but also isolated from the family. Some of the workers were coming to work from the hotel, so the country was even obliged to take some of the hotel rooms to isolated workers which are suspect, not yet developing symptoms, just to try to prevent even the health, because it was kind of healthcare workers who were targeted. So that was mainly to prevent the disease to get in the population, because that will be very difficult actually to get things to be controlled. Now, in terms of critical care, I think Rwanda has done a great job, because in the history of Marburg, we did not see anyone surviving coming back from the coming off ventilator. So on our case, we had the country was able to set up a critical care unit for Marburg disease people, and among 9 people who were admitted and ventilated, 2 of them were able to come out of the event and survive. But also we are having another unit, which is high dependent unit, where people who were admitted over there, most of them survived. So Rwanda also has done something about being like a pioneer use of experimental treatment and vaccine, where the CV was used. Even me, as I said, I received it, and I think it has done something in terms of survival rate, but also initiating this vaccination was something great. So Rwanda also has done something about international collaboration, and I remember when I was admitted, every morning there was a round done by doctors, different doctors. Among the doctors were having people sent by the World Health Organization. So actually, the collaboration was not only on a higher level, decision makers or whatever. So it went from up to down at the bedside of the patient. Next. Now, do we have something to learn about what Rwanda has done in terms of the management of the whole management of Marburg disease pandemic? Yes, of course. That's why this is an article which is out. It has been almost a week. I don't know. Yeah, almost a week, if I remember well. And this article has a description of everything that Rwanda has done, so that it can, first of all, be able to contain this disease very quickly, and being able to have this mortality rate, which is kind of low. So there is something which is public health. So if people are going to be able to go through this article, there is just an amazing job which was done in terms of public health to be able to trace like number 1 person who got the disease. Also how the Rwanda used this partnership to be able to butcher whatever have been done, starting from the tracing, isolation, management, and everything. You will also find what have been done in terms of treatment, starting from the supportive management, but also this vaccination and everything. Yeah, so next slide. Oh yeah, so my special thanks to my friend from USA, Anna knows her. And actually, thank you, Anna, for connecting me with such a great person with a big heart. So Andrea, she's a pediatric anesthesiologist from US. So she's like, she has been my energizer, encouragement when I was hospitalized, because she could send messages morning, midday, and even the evening, asking me, how am I? But she was also to mobilize a team to play for me. She knew that I'm a believer, and that's really kept me, energetic. And I think part of why I was able to fight this disease was from her. Thank you so much. Yeah.
We all love Dr. Murray and feel very, very honored to have her working with us as a colleague at Stanford. And I'm just absolutely thrilled that she was able to support you during this challenging time. It's very difficult. Well, there's so much to talk about, but I think being a physician and being an ICU doctor, we often will relay our experiences as a physician, and it's not very common that we're able to actually relay what it's like to be a patient. So I think your perspective is incredibly interesting for that reason, but also just the performance of Rwanda's Ministry of Health is truly remarkable. For those who have not thought much about Marburg virus, historically the case fatality rate was upwards of 80%. So if you got Marburg, you were most likely to die. And the case fatality rate during this outbreak in 2024 was 23, which is remarkable, 23%. Can we talk a little bit about, Francois, first, before Marburg, tell us a little bit about the healthcare system in Rwanda. Is it public? Is it private? What's the population of Rwanda, and maybe some of the greatest barriers that patients face in the healthcare system at baseline before Marburg?
All right, so our country has a system which is both private and public, mainly public is dominant. And our population is now 14.5 million. And mainly what the greatest challenge for our people is economy, like any other African country. So in terms of access, it's not really bad because every population, everyone can access medical care in 2 hours, 2 hours drive, which is not really bad. And about the system, and so our system, I will talk about mainly public system, public health system, because the private one is all differ, depends on who's belong. So we have levels. So we have, like, starting down, we have health centers, which provide like the minimum. We have district hospitals, which provide up to the C-sections, and where we have doctors in different fields, actually from surgical to medical. We have level 2 teaching hospital where the care start to be specialized. And we have also like the level up, which is referral public teaching hospitals, like the one I work in, which has like everything. So in terms of the quality, I can say that like any other country of sub-Saharan Africa, we are having the same challenges about the system, the lack of materials and whatever. But my feeling is that, like someone who is aware of what is happening around, my feeling is that our country is always like aiming like the standard, is always aiming like the standard. If you come today and you are the one to testify that, you will come in 2 years and find new things. So always aiming the standard to be given to our patient and aiming higher. So there's always something new in terms of our medical system. Like now we have started many fellowships, which is something which is going to improve the quality, the standard of care of patients receive. So there is something which is a strength about our health system. So even if our population is facing like economy issue like others, but we have something which is insurance for the community. And this is like 100% everyone has to have it if he's not having another personal insurance. And this was made that every Rwandan should have it at a lower price, very low. And for people who are not able to afford that very low price, the Rwandan take into account of it, like they pay for them. So it's like Rwandans have health insurance at 100% rate, which is something which is big. Yeah.
Yeah.
Thank
you. Yeah, thank you. I have, I think it's one of the maybe greatest privileges of my career is to have been able to witness the vast improvements in Rwanda, in the economics of Rwanda, in the infrastructure of Rwanda, but also in the healthcare system, and to watch wonderful anesthesiologists like yourself build these programs such as the Pediatrics Fellowship and Critical Care Fellowship. I want to ask you a little bit more. Of course. I want to ask you a little bit more about your personal experience with Marburg. Tell us a little bit about when Claudine came in and she was ill, because at that point you did not know that it was Marburg. Is that right?
Yeah. I will excuse myself. Whenever I start to talk about this, sometimes I get emotional, but I will try my best. So when it started, actually, it started when we were having in another hospital, some people dying, patient dying from what was called malaria, unusual malaria.
Unusual.
Dying during intubation, and people breathing everywhere. So we had this around a week, because I worked there as part-time. Dr. Claudine, my friend, was working there as part-time in the ICU, but me, it was operating. But because we are in the same platform, we could see what they are posting. I kept wondering, I'm like, there might be something else. I'm quite sure even there was someone else who was saying, maybe this is something else, but no one speak up about it. Now, after like a week, it was Sunday, because Claudine was a closer friend I have ever had, and it has been like, yeah, Claudine, I knew her. We only, she joined the program. I was her program director. She was the very ever, she was like the top in her class. She was the best clinician when she finished. She was the best ever friend you can have as a person. So she was exceptional person. Then she called me on Sunday because we were very close, 24 hours, over 24 hours, either physical or whatever. She told me, I feel unusual fatigue. I'm like, you have been working this past day, working so hard. Please try to rest. He said, yes, let me try to rest. Then maybe it's going to go over. Then next, like a few hours later, she told me, I'm having even fever. I'm like, no. So then I told her, let's test it for malaria. So we tested for malaria, it was negative. Few hours, she told me, I'm starting to have nausea and vomiting. I'm like, no, come to Seashika, we run exams. We did exams, nothing was coming up. So after 3 days, I received her call. That was 1 a.m. in the night, because her husband was working far from home, was just coming home in the weekend. So I was the first person to call. She called me. That was 1 a.m. I think I'm going into shock because I've been vomiting very, badly. Then I called someone who is near her home, because I'm not near her home, to go in the house and pick up her. Then we rushed to the hospital. Arriving there, she was having all GI symptoms. You can imagine, she was having fever, so that fever is actually 40 and above. It's not a simple fever, 40 and above, which the vomiting and diarrhea is something which is not, it doesn't really get better with any kind of measure you take or medication, and the fever as well. So nothing can really, then we started the journey like that. As the time goes, some hours you get a new symptom. So next morning, she did not get better. Instead,
Were you thinking,
now.
were you thinking at this
Sorry?
point, Francoise, were you thinking at this point that she had the same thing that had maybe affected the other patients in the districts, or did you think it was
No,
related?
it was not in the district. It was in a bigger hospital.
I see.
Yeah, it was in a big, not in, actually, the bigger hospital. The other bigger hospital in Kigali, you know it.
Yeah,
So,
yeah.
because I didn't follow those patients, I did not have any. I
Okay.
did really not have. Anyone did have a clue. Now, the internist said, usually in our department, when you have a patient, we don't know what is happening. We do a whole series of exams. I was like, why guys, why are you doing all of these exams? They said, that's how we do. I was surprised that the abdominal ultrasound came with ascites. The chest x-ray came with pleural effusions. The enzymes or liver enzymes, they were like up. I was like, wow, what is this? All of us, we started to be scared. Next hours started to desaturate as the breathing becoming difficult. So that's when she was admitted in ICU. From there, we kept looking what is happening, searching what is it. We didn't find it. Everyone was called, you can imagine, And I remember.
Did you decide at any point that this might be an infectious disease, and did you consider using PPE, or were you just so focused on her care that didn't come into your mind?
No, up to that point, some people are like, this is a toxic thing. We don't know what it is, but this might be something big. But at some point, they were not able to find blood sample. And the veins were like, I removed my gloves because so that I can touch very well. I was like, the blood of Dr. Prodin is not going to do anything for me. Yeah, that's what I did. And actually, when I got the sample, the blood was spread on my body. I was like, this blood, if it scares me, it scares me. It's from my friend. That's what I said. Can you imagine?
And you led her airway management and her CPR. She ended up receiving CPR. Is that true?
Yeah. Yes. And I was the first one, even if I was not the one who was on duty. I was the first one to be called by the resident. We are going into CPR. Yeah, then I rushed to the hospital. I was the one who led the CPR, even if I was not the one on duty. We tried. Everyone was like scared of losing Dr. Crodin. I don't know how long we have done that CPR. I can tell you from like midnight or somewhere in the night up to the morning where everyone was around. That's when someone came, said, no, you have to stop. I couldn't stop it. I was just scared of losing her. I didn't declare her die. Someone else did it, yet I was the one leading the spell. Yeah, that's how it was.
I'm sorry you lost your best friend. We certainly felt Claudine's loss here as well. She was also a student of mine, as you know. So I'm really sorry you lost your friend. We lost a good colleague. Can we talk now about when you first realized that you became a patient?
Yeah. So from that time, we didn't know what it is, but I kept saying we should do autopsy or other so that we can know what killed Claudine, who was healthy, just coming like that, then we are losing her. So the administration of our hospital, I really thank them a lot. They did a great job on investigating more. I remember the DG called the Minister of Health, telling him we are dealing with something we don't know, so we have to find out.
And DG, for those who are unfamiliar, is the general director, the director general of the
hospital. Yeah, Director General. Then that's where they started investigations from everything, including those, Marburg and whatever. And that was on Monday morning. And on a Thursday, that's where they called me in their office, actually. And they told me, it is Marburg. I was like, okay. I smiled. And then, someone who was announcing, he was like, shake the head. Yeah. From there, I start to think, mortality rate is 90%. Yeah, I see. And everyone else was like, when they got it, they were like, so if Francoise is the second one to die, if she doesn't die, or if she doesn't get it, that will be something right in the book which doesn't exist. That was what everyone was saying. Yeah. Then
I actually remember receiving a text from you, and I could detect your fear, and you conveyed to me that you had led her CPR and that you had her blood actually on your hands. And I remember that fear that you conveyed to me. How did you handle that? Francois, you're a mother and a wife. How did you handle that news?
I mean, I tried to keep calm because I even tried to keep what I was doing. It's because we knew that if you are not having symptoms, you don't transmit it. But of course, you don't know when the symptoms are going to come. So I try to keep my distance with the social, like every social thing was stopped by me, by just myself, my decision. And then I kept doing what was possible. I informed my husband. I didn't take any distance with my family before I get symptoms. But I think even when I get symptoms, it was very hard to keep distance with my 8 years old who I was still nursing. So it was really not easy on my side. Yeah. It was not easy.
How did your husband and you both went into isolation? Were you isolated together, or were you isolated separately?
I mean, isolation is isolation, except that, my husband claimed, was like, can you give us 2 rooms which are closer? Anywhere. Yeah. We're given 2 rooms which are closer. And actually, I was caring about him. He was more sicker than me. So whenever, managing these cases, you have to wear this kind of PPE and whatever. So whenever they were like, because IV fluid was like the main cornerstone of the treatment, actually. So I could take my mines and just hang for him. And because I was able to drink, comparing to him, I was taking more IV and giving him, So yeah.
So this is one of the remarkable things about Rwandan public health response, both during the COVID-19 pandemic, but also during Marburg, is their ability to isolate patients. And I know in COVID-19 they had a special COVID hospital where they would send the patients to separate them from the general hospital populations. How was it different or similar in Marburg? Were you in a separate hospital? Were you in a hotel room? How were you isolated and being treated at that point?
So there was a center which was like immediately established, and all of us were there. And so everyone was having his own room. Actually, no one was allowed to move to another room, just to limit the cross-infection thing. And everyone who was positive was immediately deployed to that center. And we were having all facilities over there. So we're having doctors, medications, including the supportive medications, IV fluid, and the others. But also we're having a whole package a patient would need. So including nutritional support. So the nutrition was really like high top over there. You could get whatever you want. But also they made attention on, things which will be supportive in that period. We're having all medical personnel we might need, including psychological supporters. So we were really having like everything over there in the center.
One of the really interesting cultural differences that I see in the Rwandese people, maybe compared especially to Americans, is the community in Rwanda really does what it's supposed to do when it comes to public health, and they follow instructions of their government and their Ministry of Health, whereas Americans make up their own minds about things. And often, I think that is one of the reasons why the United States did really poorly during the COVID-19 pandemic. How did you feel about taking experimental medications and vaccines? Did it make you feel optimistic, or did you not trust, or how did you feel about taking these medications that had, I mean, you use the word pioneer, which I agree with wholeheartedly. It's very brave of the Ministry of Health and the patients in Rwanda. But how did you feel about those things?
So that's a great question. Actually, as a doctor, someone who knows things about the healthy medications and whatever, like me personally, I was having a mixture of emotion, and thought. I was like, yeah, I don't have choice, so I have to take it. Probably it's going to do something. But personally, I was very, very scared of taking the first dose. And this is real. This has been a real fear from me. I was thinking, what if? What if I have a bad reaction about this? Yet I knew that this is not 100% medication which is going to get me cured. It was somewhere at a certain percentage, and yet I'm just taking it because I don't have other choice. But again, I was really scared of getting something bad from it, which can actually kill me more than the disease. Yeah.
I
But
imagine
the other thing is that I was trusting my country, I was trusting my country, and I know that they are doing like everything possible to just get better of us, right? Yeah.
What did you tell your children?
I did not tell them anything. I didn't have anything to tell them. Like maybe because I have four, maybe I didn't say it. One was 13 at that time, was in boarding school. We tried our best to hide that because I know her. She could collapse at school, having no one outside. The other one's 8, which is a boy, who usually doesn't care about anything, but 3 years and 8 months. So I really didn't have anything to tell them. Maybe you can ask me, what did I tell to my mom? Because she was really scared of losing both of us and staying with those 4 kids. I kept telling them we are okay on the phone. We are really okay. We are going to be okay soon. But they were scared because they all know that the mortality rate is up to 90%. But whenever I was like about to call them, I was like, okay, yes, we are okay, kind of, following a good voice. Can you imagine? Yeah, that's how, yeah.
I think there are so many remarkable things about this story. One is going from a mortality rate of 80 to 90% to 23% really speaks to Rwandan public health measures and the population of Rwanda who believes in public health measures. It's also incredibly remarkable, Francoise, your strength and your grace through the whole thing, and being a survivor of Marburg, because there's very few.
Yeah.
How do you think this changed you as a person, as a mother, as a doctor, as a friend? What have you learned from this experience that you would like to share with us?
Yeah, so I learned that life is very expensive. but you can also lose it in a minute. I learned that whatever we do, we should also love ourselves and find time for ourselves. As a doctor, I learned that whenever you have a patient in front of you, probably he or she's feeling the same. She's like, I am losing my life, and I'm counting on this person to either bring back my life. So we should do our best. I learned that when you do your best, probably there is certain percentage which add on the rate of saving someone. But also, as doctors, we should get empathy with patient, put ourselves in their shoes so that we can treat them better. Now, about the families, yeah, sometimes we go in our career things, then we forget our families. I learned that we should not forget our families because those were among the strength I was having, every morning getting a message from your sister, your siblings, telling you, we love you so much, reminding you things you have done for them. You were not even, remembering. Then thinking about leaving your kid behind without having anyone. So all of these are lessons learned by me. So I have a new style of living now. Yes, I'm still a hard worker, but I have to find time for other things, which including me.
Yeah, definitely you. I say this all the time, but when we get to the end of our lives, nobody says I should have worked harder. Most people think about their families and their friends and their loved ones. We only have a few minutes left, Dr. Francoise. I tried to answer one of the questions from the Q&A, but I want you to weigh in as well as the expert in Rwanda. For the families that could not afford hospitalization, were they given home quarantine recommendations, or how did patients in small homes manage during the outbreak?
Or like patients who are having other diseases or just from Marburg?
Well, I think the question was about economics, if you can't afford to go into the hospital. But my understanding is during the outbreak, the Ministry of Health and the government would take care of all of the patients, and anybody could be isolated in the Marburg Center. And that was really driven by public health, not economics, and not an ability to pay. Nobody really had to pay for that treatment. Is that accurate?
Yeah. So the Ministry of Health took care of everything, not only for the healthcare providers, but for everyone who got Marburg. Yeah.
Have you noticed?
Even for the isolation, everything was covered by the government.
Yeah, that's remarkable too. Have you personally noticed any long-term effects from Marburg? Anything changed with you as a patient?
So we had a lot of care. So starting from when I was discharged, first of all, me and my husband spent a whole week without being able to get out of the bed and feeling like we are energetic. We are very weak. My husband kept having fever, even if the test was negative, up to almost a week and a half. So let alone, personally, I had a severe psychological issue. I couldn't, first of all, find myself going back in the hospital without having my friend whom I was working with. Secondly, I had an issue of facing the same face. So when I entered in the hospital for the very first time, I was avoiding everyone I used to know. And I was not even able to attend the morning staff meeting for a while because I was avoiding everyone. So when I entered in the operating room for the first week, I was just going there and going outside on the sun, sitting while I'm supposed to attend to the patient, and someone else was doing my work. So
Has that gotten better? I mean, that's a typical a stress response. That's a stress response to trauma, something very traumatic. Has that improved for you?
Yeah, it has improved. So the computer work was worse. It was like very worse, but now I have improved. I'm still having kind of transient amnesia. Yeah, up to now, I'm still having some kind of small, it is improving, but generally, I kept improving over time. So I'm back to kind of normal, even more. I think now I'm even working more harder than before. So which is something good. Yeah, thank you.
I'm so impressed by you, as you know, Dr. Francoise, and I really respect the way you have taken this very challenging experience, and now you're publishing articles and you're presenting at international conferences to share this experience, because it is so rare that we get the personal account of patients' survival that also has the perspective of a critical care doctor. So thank you for sharing your experience. We have one more question that I find interesting, and that is, how long had the vaccine development lasted, and when was the decision made to develop one?
All right. I don't have any idea on that.
I have a little bit of an idea.
When I was sick, I don't think anyone was like really concentrated, whatever you are, like a patient who is just there, and afterward, I was like not interested really to read about it. Can you imagine?
No, I can't. I would imagine I would be similar, but
Yeah.
to answer the question, the Marburg vaccine has been in development for many, many years, because Marburg was first discovered in 1967. So much like the COVID vaccine, these vaccines are developed over years and years and years. And so there were at least two different versions that had been developed in response to previous outbreaks. So the vaccine, although it was the first time that it was actually used in the patients, it had been in development for many, many years. So a lot of our vaccines, we think they're new. I think there's some confusion even about the COVID vaccine, but these vaccines are in development for many, many years. It's just that it was first time it was actually used, as far as I know. But it wasn't something they cooked up overnight, I guess I'll say. Yeah.
Thank you for coming in.
What do you want the world to remember about Rwanda and the Marburg outbreak?
All right. So I want everyone to remember Rwanda as a small country with bigger in terms of incredible strength and resilience of communities and health workers in the face of terrifying outbreak. And despite limitation resources, the collaborative effort between local team, international partners, and the government showed how swift action, transparency, and solidarity can save lives and contain a deadly virus. There is also this importance of compassion and courage. And remember always, behind every case is a person, a family, community facing fear and certainty. And from my experience taught me that while the virus is ruthless, the human spirit can be even stronger. And investigating in preparedness, supporting frontlines worker, and listening to affect community are crucial steps we must never forget. So something also I learned, and everyone should learn, communication is really key, because from my experience is that when there is, if we should have had a very established and working communication channel between the very low, like those ones who are attending the patient in the beds, with the higher level, we should have had lower mortality rate than what we had. Yeah.
Francois, I know you know this already, but you have many, many friends at Stanford, and we love you very much. And
Thank you.
we are very, very grateful to you for sharing your experience with us and for your strength and resilience of caring for others even when you were sick. So thank you so much.
Thank you.
You're very welcome.